So, as I move through this particular skeleton of the skull, so which is a content of the like a next next semester, but we have to cover that content as well. So, this is a skull bone that consists of the skull together. The skull bones can be divided of two parts. One is known as the neurocranium, so which is covering the brain. Another part which is covering the facial region. So, we call them as bone of the face and the bone of the brain. So, this is how this particular whole skull can be divided off, the bones here. Now, if you see this particular bones in the skull region or neurocranium region, they have two tables or two layers. One is outer layer, other is inner layer. In between them, we have a space which is lying here. We call them as diploic space or the diploid spongy space. This particular diploid spongy space is occupied by the marrows or which is known as bone marrows, red marrows, which is present in here. So, this skull bone have got outer table OT, outer table has an inner table which is thinner, and in between them we have a space we call them as diploic space. So, which is filled up by the marrows. So, this is how this particular whole skull or bones of the skull they are layered. Now, as we are saying here, the bones in the skull region can be divided into two parts. We call them as neurocranium, which is covering the brain region. That is like frontal bone, parietal bone, occipital, temporal, sphenoid, ethmoid. These are the bones which are framing or surrounding around this particular brain region. Other is the facial skulls, like facial bones, like nasal bone, lacrimal bone, the mandible, the maxilla, the zygomatic bone, cheek bones, etc., etc. So, classically we can divide this particular bones into two parts, which is covering the brain and covering the facial region. That is two basic difference, and you have to know these names here of different types of bone. So, this bone which you are seeing here we call them as frontal bone. On the side which you are seeing here we call them as parietal bone. Under that parietal bone we have bone we call them as temporal bone, which is related to this ear. Then on the back side we have a bone we call them as occipital bone. So, which are like a frame bones over here, and deep inside we have a bone we call them as sphenoid bone. So, this particular bone which is present in the midline, which looks like a bat which is extended wings over here, we call them as sphenoid bone. So, this particular sphenoid bone which is present in the midline or middle portions of it, this is the back side, this is the front side, this is a frontal bone, parietal bone, occipital bone, and down there on the side we have this temporal bone. Temporal bone is related to this particular like a ear region, and in the front side we have this nasal bone, lacrimal bone, maxilla, mandible, zygomatic bone, cheek bones, etc., etc. So, this is how this particular whole bone in this particular region is classified with. Now, this is what we are seeing here, the bones in the face region we call them as facial bones, which you are seeing in the front vision on front side. And if you cut this particular bones, you can see the deep inside the nose we see some other bones as well, we call them as nasal bone or nasal septum bones, like a vomer bones. And then we have this particular bones which is present on the lateral side of the nose, we call them as concas. There are three such bone pieces are there, we call them as concas. So, inferior concha, middle concha, superior concha, they are like looks like lofts, like a loft in the in a wardrobe or kind of things. So, this bone which you are seeing here is septum bone. So, this part is partly formed by the cartilage and partly formed by this particular bones, like palatine bone, vomer bone, they are forming this particular the nasal bones or nasal parts of this. Now, how this particular skull you are looking in here, how they are looking at this skull, we call them as norma, the look. Just like anatomical position, we call them as anterior posterior or this particular lateral or oblique. The skull is how it is seen, we call them as norma. Norma means that how we are looking at it. If you are looking at the skull from the front side, we call them as Norma Frontalis. If you are looking at the back side, we call them as Norma Occipitalis. From the sides, we call them as Lateralis. From the bottom side, if you are looking at it, we call them as Basalis. If you are looking from the above, from the sky, we call them as Verticalis. So, Norma is the look, how you are clicking this particular image, and which side you are looking on, we name accordingly. If you are seeing from the front side, the skull, Frontalis, back side, Occipitalis, sides, Parietalis, underside, Basalis, above, Verticalis, right, this simple word. So, Norma how you are looking at it. So, if you are looking at this particular scalp right now, so which view we are looking at? The star on the table? Frontalis. So, this is what? Norma Frontalis. Now, on the Norma Frontalis you cannot see all the bones, which is this facial bone or this cranial bones is there. So, what are the bones you are seeing? That particular view is the Norma Frontalis view of the skull or cranial bones. I am looking at the skull from which view? Lateralis. So, I am not seeing all of them, right. So, on the lateral view bones I am seeing here, I am saying that normal lateral view of the skull, like showing parietal bone, temporal bone, etc., zygomatic bone, mandible, etc., See that what you are trying to see? So, each of these things we are going to see. So, you are looking from above. So, what you are going to see? If you are looking from top, you are seeing this view, we call them as verticalis, and what view is normal view. And what you are seeing here, frontal bone inside, and then we have the parietal bone right and left, and a little bit of occipital bone you are seeing here. And they are making some kind of joints in between, we call them as sutures or sutural joints. Now, these particular sutural joints meet at some points, we call them as bregma, lambda, etc., So, we will be talking later about these particular unions. So, we will just focus on this particular bones and the views that you are seeing here, get used to it later on as we move forward with this particular cranial bones, we will be learning the detail of it. So, this is what you are seeing from the vertically, you call them as Norma Verticalis, and what bone you are seeing in the vertical view, that what you have to mention, like frontal bone, parietal bone, and right and left parietal bones and occipital bone is visible on these views. And there are some union points are there, we call them as sutural joints. Some sutural joints are there, we call them as coronal suture, sagittal suture, which you seeing this particular suture which is running across over here, we call them as coronal suture. You see this particular union, we call them as sagittal suture, splitting this particular coronally and sagittal, coronal view, sagittal views coming from these particular sutures. And they are uniting at a point like in the front side where this coronal suture meets with sagittal suture, this point we call them as bregma. Similar to that, there is another suture we call them as lambdoid suture, which is uniting with this occipital bone with the parietal bones. Now, where this particular occipital suture uniting with this particular sagittal suture, in the union point over here we call them as lambda or lambdoid point. So, bregma and the lambda is a kind of point where you are meeting with the coronal and the sagittal suture and this lambdoid suture with these sagittal sutures. So, this is what we call them as Norma Verticalis. So, bones is visible over here, these are the cranial bones over here, and these are the sutures that is visible. Coming to this particular view that you are looking right now, we call them as Norma Frontalis. Now, on the Norma Frontalis, what are the bones is visible? This bone is visible, with this bone we call them as frontal bone. Then we have this particular bone, we call them as over here, we call them as maxilla over this particular region. Right side, left side maxilla uniting and teeth are fitted on it. Then from the maxilla we have a bone, this bone where I am putting the cursor on. This is a cheekbone, we call them as zygomatic bone. So, this zygomatic bone is visible, then this bone, parietal bone is visible on here. So, this particular views are visible on these bones. Then we have this nasal bone, lacrimal bone, they are present, and this septum, nasal septum, then we have the mandible, etc., These are the things which are visible, right. So, these bones on the Norma Frontalis is visible with this. From the sides, which I am looking right now in this particular skull, if I am looking at, we call them as Norma Lateralis. Again, you are seeing some bones. This bone, what bone is this one? Frontal bone. This bone, parietal. Under to the ear bone, temporal bone. This bone, uniting over here, zygomatic cheekbone. This is maxilla. This is mandible. This is, so these are the view. Which view? Laterally. What lateral view? Norma Lateralis, right. This is what you are seeing, and the sutures, this suture we call them as coronal suture. So, this is the sutures that you are seeing here making over here. Along with that, we have some kind of wings of the sphenoid which is deeply placed, greater wing of sphenoid which is meeting at this particular point. This is a sphenoid bone which you are seeing here, little bit of it uniting with this particular point, greater wing of the sphenoid which is coming over here making a joint. Similar to on the back side, if you are looking this particular bone from the back side or the skull from the back side, we call them as occipitalis. Now, what the bone you are seeing here? The same thing with that you are seeing here on the back side. So, in the back side posteriorly we have this particular bone sutures which are visible on the. So, this is what we call them as normal look, or how you are looking at the skull, what bones you are looking at it, and what are the sutures that are present in it. Little bit we will be learning. So, major two sutures I am focusing in here, one is sagittal, other is coronal, which are two important, and one suture which is called them as lambdoid suture. So, which is occipital bone and this parietal bone uniting with this temporal bone in the sides, which is present in here, and this particular suture we call them as lambdoid suture, and lambdoid suture meeting with this sagittal suture, that particular point we call them as lambda, and other one we call them as bregma. So, bregma, lambda, sagittal suture, coronal suture and lambdoid suture. These are the few things about the sutures that you have to keep in mind at this particular level. So, the other view, if you flip this, look from underside, just opposite to vertical, we call them as looking the base, we call them as Norma Basalis. So, if you are looking at it like this, Norma Basalis, then what you are seeing here, what are the bones that is visible out here, you have to identify that as well. So, this is what you are seeing, this particular Norma Basalis. These basalis can be divided into three parts, anterior part, middle part and the posterior part. Posterior part is divided on this point where you see that this opening we call them as foramen of magnum. We see the spinal cord is getting out of this particular brain or cranium through that particular foramen. So, you draw a vertical line anterior to it, you find posterior bones to it, we call them as posterior part of the Norma Basalis, and we draw a line through this particular bone, we call them as this particular line on the wing of the sphenoids over here, back side of this particular bone. This bone which you are seeing here is palate. So, this is a palatal bone. So, on the posterior half of the palatal bone, in between them we have these middle portions of this particular Norma Basalis, anterior portion, middle portions and posterior portion of Norma Basalis. Anterior part we see this particular bone, we call them as palatal bone, and here is the opening here, we are seeing here, this is known as posterior nasal opening, we call them as coena or coenae. So, these are the things which you are seeing here in this particular anterior part. Middle part, that is between these two, we have these particular structures like this particular bone, sphenoid bones which is present in here, and this particular sphenoid bone which is having moving to the sides, we have this temporal bone which is present in this particular region. So, this particular sphenoid and this temporal bone is largely present in this part or parts of these two bones, sphenoid and the temporal bone, they are basically crowded or present in this particular region. There are different parts of the sphenoid bone like styloid process or tympanic plates, comus plate, there are sub parts are there. So, basically temporal bone and the sphenoid bone, they are present in the fronts, middle portions, and if you are going to the back side, we have this one bone which is present in here, occipital bone. So, the occipital bone, majority of it is present on this, along with this particular opening FM, we call them as foramen magnum. It is a large foramen. This is how this posterior view of this Norma is described. So, these are the things that you have to keep in mind related to this particular looks of this particular cranial bone or the skull. Verticalis, Norma, what are the bones visible, what are the sutures visible out here, coronal and sagittal is the important one that you have to know. Along with that, the union point, bregma and lambda. So, what do you see by the lambda? The union point of the sagittal suture which is present on the midline vertically splitting in here with this lambdoid suture. So, bregma is a union point between the coronal suture and the sagittal suture and lambda. So, these 2 points that you have to know or kind of like carry with you. Norma Frontalis, the bones that is present, front view. Norma Lateralis, what are the views is present along with these bones. Occipitalis, what are the views of the bones that you are looking at it. And lambda, sagittal suture, lambdoid suture, these are the few things that you have to remember at this level. Nothing big, nothing small, and basalis that you see that. Anterior part, middle part and the posterior part. Posterior part is largely by this occipital bone, middle part is by these 2 bones. We have this particular midline bone, sphenoid bone, and the side is a temporal bone, temporal bone which have got different parts of it. Front side, we have this particular bone, we call them as palate. So, we have the palate, we call them as hard palate. So, this is made of bones which is known as palatine bone. Posterior part of the palate, we have this muscle, we call them as soft palate. So, if you open your mouth, you find this particular palate which is present on the front side, we call them a hard palate, they are made up of bone. If you move to the back side, bone is not there, only muscles are there, we call them a soft palate along with the uvula which is present. So, this is what you have to keep in mind related to this particular norma things, which is a easy introductions to the skull whenever you are going to start studying it. And later on we will be learning the detail of this particular norma, each individual, and we are going to learn about this particular cut sections of it. We call them as fossa. This particular region we call them as fossa, we call them as cranial fossa. The space which is present in this cranial part of the bone, and again divided into three parts: anterior part, middle part, posterior part. We call them anterior cranial fossa, middle cranial fossa, posterior cranial fossa. So, we will learn that subsequently, and this particular bone, mandible, individually as well we are going to learn these things in subsequent sessions. So, this is what is not included in your examination though. So, I do not want to just do heavy introductions on this basic things that you should be knowing. What do you mean by the norma? Norma Frontalis, Lateralis, Verticalis and Basalis, and what are the different views is showing us in terms of the bones, and what are the two basic classifications of the skull bones. Skull bones can be divided into two basic parts: skull bones, cranium, skull bones, facial, right. So, we call them as neurofacial bones and neurocranial bones. Then which are related to the face bone, we call them as face bone, like the lacrimal bone, nasal bone, these are maxilla, they are face related to, and some bones related to the brain, we call them as cranial bones, clear. So, these basic classifications and the normal things that you have to keep in mind related to this particular parts. So, neurocranial, viscerocranium, facial skull and brain skull, and they are having two layers. Whenever you are seeing this particular skull bones, they are having two layers: outer table, inner table. No complex names are there. Outer layer, inner layer. In between them, space. The space that you have to keep in mind, diploic space. What this diploic space is occupied with? Diploic space is occupied with the bone marrows. Now, these bone marrows are penetrated by some vessels as well. Some veins are there. We call them as diploic veins, which are feeding or draining this particular diploic spaces. So, this is what we have to know. Covering over here, we call them as periosteum, which is covering this particular outer table and inner table, we call them as periosteum, which is the bone lining membrane, we call them as periosteum, and the inner side of the periosteum we call them as endosteum, right. So, outer side covering we call them as periosteum, inner side we call them as endosteum. So, here one covered by outer and inner surface by this particular periosteum, which is outer side covering and inner side covering, both the same, we call them as periosteum. So, this is what you have to remember here. To summarize, we have these two particular cranial bones divided onto two parts: facial bones and cranial bones. This particular cranial bones and the upper part of the clavia or this region has been divided into two parts: outer table, inner table and diploic space, and this particular region have got cranial bones, facial bones is based on how studied, how we are looking at it. We call them as Norma Frontalis, Basalis, Occipitalis and Verticalis. So, how we are looking at it, you are seeing this Norma, and along with that these sutures, and along with the bones that we are seeing it. Along with this, some other things are there which you are going to learn individually when we are going to talk about it. So, here we talk about coronal suture, sagittal suture, lambdoid suture, and three meeting points, two meeting points, bregma and lambda at this particular point. So, you should be knowing what do you mean by bregma, what do you mean by lambda, what do you mean by the lambdoid suture, coronal suture and sagittal suture, three of them. Okay.